get into it. Now I charge per breath. I was overlooked. Now I'm booked past death. Had tables turned. I flipped the room. Now they whisper my name like I'm bad juju. I birthed trends they try to mimic. Did it solo, ain't no gimmick. They took notes while throwing shade. Now they pressed and I got paid. I'm not one of them. I'm one of one. Trying to match my glow. Baby, you're outdone. I'm made for bigger. Now basic. Made for thrones, not fake shit. I don't chase, I check. I don't follow, I flex. I'm made for bigger things. Tell the room I said what I said. Big body blessings, big boss moves. Try me and end up a lesson. They talk about me in rooms I don't enter. I haunt them like regret, make them bitter in the center. I'm that girl, the headline in the smoke. They playing in mirrors, I'm shattering yoga.
All right. Hello, everyone. Welcome back to the Ask Astria Show on 90.1 WMPR out of Jackson, Mississippi. And I'm so grateful to be here. I am your host, Astria Goolsby, your personal fitness professional. Guys, today we have a very special guest, a very, very, very special guest. I have Mr. Ronald Henry. How are you doing, Ron?
I'm doing fine, Astria.
I love it. You're welcome. Thank you so much for agreeing to be on the show with me today. I know you have a lot of valuable information today, and I am excited to get into it with you.
Okay.
All right. So, Ron, you do a plethora of things. You are a pharmacist. Can you kind of go into what your background is?
Oh my goodness, Astria.
Yeah.
I do quite a bit. I grew up, and I hate to date and tell you how old I am, but date myself. But I grew up really in a age I was hyperactive as a child. I kind of got out of that, but I still like to do a lot of things. That's why I wound up doing so much, because I can't sit still. So not only I had my pharmacist license, so I do pharmacy, but I also do video work, photography, carpentry, and that's just a few of the things I do. So, and I'm always busy. So my wife would tell you that if she was here on the show with us today. Yeah, I'm doing a lot of things.
And your wife, she's into nursing, so you both are in healthcare.
We're both in healthcare.
Yeah.
Correct.
So, and Ron, me and you, we go back. Now we might not go way back, but we go back.
We go back.
It's so funny because I would have never thought that I would be in Laurel, Mississippi the first time I came to So Mississippi to speak at your event. Could you tell the people a little bit about the special community health talks that you do on a monthly basis?
Yes. We started about almost 2 years ago now. And I just had this desire, and I had a passion to get out and help our people understand their health care. But really all people, but especially our people. And so through my church, we developed a program where we have once a month for 1 hour. We just talk about health. We talk about various topics. And for about 6 months, I did all the presentations. But then it occurred to me, maybe you can get other people to come in and join up. So we've had herbologists, we've had people who've done cooking classes, people who've been plant-based diets. And right now I got a eye doctor set up to come in. He likes to talk about the eyes and this effects on the health. So we do that. And of course, you've been there twice, as a matter of fact. And she was very, very well received. And of course, they're anxious for you to come back and talk about this weight.
I know. And I really loved your community of people. I mean, it for those of you out there who are community speakers, public speakers, it's not easy to get the ground, I'm going to say the ground community, the community that's like really in the trenches. I guess you could say, I like to say I'm in the trenches when I speak. I like to speak in the trenches because that's where the real numbers are. It's hard to get them to respond. But
That's
when
right.
I came came to your class, I mean, they were there. I even saw people with pen and paper. They were raising hands before I had questions. And I was like, I'm going to have to do some research next time I come back. And when I set expectations and told them that I would be back, they came back with follow-up. They came
It did.
back with told me how they implemented the things that we talked about. And we talked about diabetes prevention and lifestyle change, which is very close to my heart. I'm going to get back into that, guys. I did not leave that alone. I didn't leave anything alone that I've ever talked about. But, you know, God and his timing is always perfect. And so I try to make sure I follow that. But I mean, your community of people was amazing. And I do want to ask you, you said that you have been having this community meeting for 2 years, and it's been consistent for 2 years.
It's not been consistent for 2 years. That's what I'm
Okay.
glad you said that, because started out slow, but
Mm-hmm.
I had encouragement from the pastor of my church, along with other members, that said, just keep going. Just keep going, and people will eventually start to come. Because, like you say, I know I call them the grassroots people. Because if you can ever get them involved, then they get
Mm-hmm.
involved, they get their friends involved, then it moves on up to the next level. So that's why we really start there instead of start with your healthcare professionals up top and coming down. We start from the bottom and go up.
Mm-hmm. And that's really how you move that needle. That's how you really get those numbers and you see that change is when you are out there in the trenches, grassroots people, and you start with them and help them to understand. Because I don't think a lot of healthcare professionals understand, and I'm not going to say that they don't understand, but I
Yeah.
think because they do have their own world and they have their place, right, when it comes to helping the community. But it's sometimes there's a loss in translation.
Mm-hmm.
And that's where I love to come in as a personal fitness professional. That turned into my goal, was to help people to understand what healthcare is trying to say to them, because you have healthcare gets mixed in with marketing. And
Mm-hmm.
I do not like it, but healthcare get mixed in with marketing, and people don't really know which way to go. They don't know what to believe. They don't know what to listen to. So being there to be able to translate what the media is saying about healthcare, what is in the studies, and what their doctor is saying, and how it relates to what they have access to. Because when they don't understand, people don't understand that when people tell you to move or when they tell you to do things, they're talking to billions of people. And
Mm-hmm.
I have to get them to understand they're talking to billions of people. And so they have to speak very general, they have to speak very broad, very ambiguous, if I can say.
Yeah.
So to get in there and say, okay, so I'm here in So Mississippi, and you guys only have, and I'm just saying, you guys might have only one grocery store,
We don't
and
have that now.
you see what I mean? But
Yeah.
that's the point,
Yeah.
and they tell you to eat fresh fruits and vegetables, but
Mm-hmm.
where are you going to go to get those? So how do
Exactly.
I translate what the doctor is telling me to do to match the resources? So I think that what you do is a beautiful thing, and my hats go off to you, and my multiple hats go off to
Yes.
you.
Yes.
I wish you success, and I ask that you just continue to do what you do, because it's needed and it's appreciated.
Well, thank you. Thank you.
You're welcome. So this month is Men's Health Month. So kings,
Mm.
um, men of the house, the man in charge, whatever you want to call yourself, this month is about you and health. And so, and I'm not going to say it's a hot topic right now, but I do feel the energy of this becoming a hot topic about men and health. And I was talking to a male friend earlier today, and I said, well, I'm going to ask you a few questions before I have the show today, just to make sure I'm on track. And he's younger than I am. And I just, wanted to make sure I ask him some questions about health, and I might just relate some of the things that he says. But I want to talk to you, and I know you have multiple careers, so I want to talk to your career of being a pharmacist,
Okay.
right? Because when we talk about men's health, people probably think that, okay, we're going to be talking to a doctor. We're going to talk about prostate health. We're going to talk about all the man stuff, right? No, we're just going to talk about pharmacy medication adherence. Okay. Are you okay with
Okay.
that, Ron? Is that
I'm
okay with
okay with that. All
you? Okay.
right. Let's do it.
Let's do it. So let's get into it, as the young people say, Ron.
Okay.
All right. So African American men are disproportionately affected by conditions like high blood pressure, diabetes, and heart disease, right?
Okay.
So, why is taking medication as prescribed such an important part of closing those health gaps? Now, before you answer that, I would like for you to explain what are health gaps?
Okay, health gaps. When you look at a global picture of health, and you look at the different ethnicities and things such as that, and you see how people fare in a general sense. I guess you can say being equivalent with each other, so to speak, is their health goes out. Whether you have black men, white men, whether you have black men, black women, there could be several different ways you look at it. But there's a
Mhm.
gap sometime between the health care of a but not just African Americans. It could be any ethnic group versus another ethnic group, and you're trying to match those groups as far as their health outcomes, where they be sort of equivalent. So if you don't, then you have a gap. You have a gap
Okay.
that you're trying to close.
Okay, so we're talking about if we're saying that African American men's blood pressure are higher in those
Hmm.
African American men that are in between the ages of 21 to 30 and versus those non-African American men, we'll say that. We want
Hmm.
to make sure that we get their blood pressures up in a healthy range so that we can close the gap of how far apart that is. Am I understanding that
That's
correctly?
correct. That's correct.
Look at that.
That's correct.
All right. So you guys heard me back there. Y'all heard me. Okay. So now that we understand health gaps, can you take us through and help us to understand why is taking medication as prescribed so important part of closing those health gaps?
Okay. Well, first of all, I wrote down a few things I wanted to mention to you. But when you talk about good health first, good health is vital to what? Our longevity.
Right.
Okay. But not just living longer, but living without a lot of ailments, that makes longevity challenging.
And you know something, Ron? I want you to pause right there. So put a pin in it. I don't think people understand that. People feel like to be in good health means that I have no ailments, or to
Hmm.
be in good health, they don't understand that it's about the quality of your life. I hear a lot of people talk about as they age because I've been training for so long. And so I've seen people age over 20 years. You go through a couple of periods and points and times in which you age, right? And things
Right.
happen, your body changes, your mind changes, the way you see the world, the way you view your world, your finances change
Hmm.
as to what you have access to, your environment changes, whether it's your neighborhood, whether it's the government, whether whatever it is, it changes. And so I try to, and people, and after a while, you can have some people that kind of go on a down slope when it comes to the way that they look at health, and they're just like, well, listen, I'm not gonna worry about it. And I'm like, man, go get checked, because it's not that you shouldn't care right now. It's about you don't want later on to be in bad health. I
Exactly.
don't care if I'm only here for 3 more weeks on this earth. I don't want to be in pain for 3 full weeks while I'm on this earth. So being in good health means basically just living a good quality of life and making, keeping that intact.
Right.
I
That's
want to make
right.
sure
That's
I just
right.
want
You you
to put
you
that
got
out
it,
there.
Astrid. You
I
got
want
it.
to put that out there. That's all. Okay, I'm
You
sorry,
got it.
Carrie.
So, and that's one of the main things we want to look at. Good health. So we talk about that, and you talk about being disproportionately affected. But I find that finds itself rooted in several things.
Okay.
Just to mention a few of them, one of them is the thing we always say, well, my parents lived to be, or my grandparents lived to be, 95, 98, and I got the same genes they got, so I'm probably gonna live the same length of time. There's some things we say when we talk about this being disproportionately affected by conditions, so we don't take care of those conditions. Another condition is our eating habits. We can't eat like our forefathers ate because food is processed differently now. And food
Mm-hmm.
is medicine, whether people want to believe that or not. Food is medicine. Food is pharmaceuticals. If you actually
Food
think
is
about it.
pharmaceuticals. Go into that a little bit. When you say
Well,
food or pharmaceuticals.
when I was in college, we had a class, and this is before I really knew anything about the full scope of what medicine was about.
Mm-hmm.
But we had a class called botany. And all botany was a study of how medicines were used, how plants were used to make medicines.
Okay.
And there are a lot of medicines that are made that are plant based, but it's concentrated. A lot of those things that if we would have been doing those things along in our lives through time, we probably wouldn't even need that medicine, but it's concentrated. So a lot of the medicines that we have come from plants.
Right.
So that's why I say food is medicine. So you have to
Because
watch
you
what
use plants to make food. Is that what
use
we're saying?
plants to make medicine. Yeah, and
Plant,
you use plant to make food too. So you
plants
eat.
to make food, plants to make
Yeah,
medicine. So food is medicine. Okay, got it.
right. And then
Okay.
another thing is when you talk about disproportionate affected is our reliance on information from our parents or peer groups. A lot
Mm-hmm.
of times we won't go do research by ourselves, but we'll
Mm-hmm.
listen to what somebody else got to say quickly. But I don't do that because of this. You shouldn't do that because of that. We
I
don't do the
heard
research
I
ourselves.
heard this and they try to tell me that. I said, who
Right,
told you that? Who
right.
told you that? Then when they tell me, I said, well, what certifications or degrees do they have?
There you go.
Can you tell me what? And they're
There
like,
you
that's what I thought. You saw
there
it
you
on
go.
TikTok from a random person who read something that might not be credible.
That's right.
Yeah. Yeah.
That's
Okay.
right. And then a fourth thing, I'm sure there are probably more things when you talk about, being disproportionately affected, but sometimes you have that implicit bias. I know you've heard of that terminology, and there's a lot. There's a lot going on with that online a lot too, for
Mm-hmm.
implicit bias. And just for those who may not know what implicit bias is, that's someone who has a bias against someone. I'm gonna give you an example in a second, without realizing that you do. Like one thing when you talk about pain management, there are some providers or physicians who think that because you're African American, you can stand more pain than a white American. So there's implicit bias there where you don't receive the treatment that you need because the bias says that you don't need it.
I wanted to go into that, but my spirit said leave that alone.
Mm-hmm.
As to why providers think that way. Where did that, I'm always, it's not, for me, it's not so much as to say that, hey, you're wrong, you do it this way, you do it that way. But for me, it's more of I try to get an understanding. In all things you do, get an understanding, right? That's
Mm-hmm.
one of the rules that I try to live by. So it is,
Yeah.
why do people think that? Where did that come from? But my brain started going back, and we went back into slavery and went back into
Uh,
another time. Not going right. And so, and because it could be painful and a touchy topic, and I want to make sure that today's focus stays on health
mm-hmm.
and health and how we can help close some of these health gaps.
Okay. All right.
All right, keep going.
Okay. Oh, you want to continue to talk about
Yeah,
it?
continue to talk about it.
Okay. And the reason I bring it up too is because, see, a lot of times when you talk about bringing it back to slavery, we don't even have to go that far because sometimes we can have implicit bias amongst our own group.
Ooh.
And that's what's interesting sometimes too,
Mm.
is because I've
Those
had,
who have more money. Are we talking about that?
well, that too, but you also have the fact that just think of a parent who tells their kid, "Ain't nothing wrong with you, suck it up, you ain't hurt," stuff like that.
Mm,
That could be implicit bias because they think you don't need it. When
mm.
you actually may need it. So it goes beyond just the scope of talking about the racial differences and stuff like that. Implicit bias can come from anywhere.
And I like to, speaking of implicit bias, I like to relate everything back to health and fitness and exercise.
Hmm.
You know, I see some trainers, someone says they do squats and they're like, oh, it hurts. And a lot of times
Yeah.
clients who are not, they're not familiar with exercise and the muscles and what happens and what the feeling is going to be as they change these muscles and the shapes and the tones,
Hmm.
and they tell them, well, nothing's wrong with you, push through it. And I'm like,
Yeah.
wait a minute now, hold up. And I tell people when they come to me, now I send them back out into the world. But if you come to me, the one thing is pay attention to, is it a sharp or dull pain in your joint?
Right.
And
Right.
where is that pain and what does it feel like? And that's when you can determine whether you should push through that, or is that something you need to stop and say, hey, let me get this checked out, or maybe I need to turn my foot a little bit to the left or to the right. There are ways to get rid of pain when it comes to exercise, but I do
Right.
want to try to stay focused on what it is you're talking about. But implicit bias, okay, got it.
Yes. And the reason I bring up those four things, like I say, there's probably more things that
Mhm.
we can look at being disproportionately affected, is because you talk about taking medications, which is very important in closing those gaps. And we look at medications, and a lot of times we don't take them like they're prescribed.
Right.
And there are reasons that we have in our mind that we don't do that. Sometimes I feel okay right now. I've seen that with a lot of my patients who have
Um,
blood pressure medications.
um,
Well, I didn't feel bad, and my eyes wasn't red, and they try to base it off how they feel and not what may be going on the inside.
or I feel better now. And
Yeah, I
so,
feel better now,
so
so
I
I
know I
stopped.
still have medication left. I feel better. And it's not even that I personally try not to take it. It's just kind of like, I feel better now. And I just kind
Yeah,
of go on and I'm feeling better. I'm glad that I feel better. And I keep going on with life. And then I'm kind of like, I forget to take the medication. And then I'm like, I'm fine.
yeah.
So I'm myself, guilty
Happens a
myself.
lot with antibiotics for sure. You got
Yes.
10 days antibiotics. Fifth day, you're feeling pretty good, so you put the rest in the garbage and throw it, put it in the refrigerator. Yeah, so but that has a lot to do, with our diabetes, high blood pressure, and other conditions we may wind up with. I feel okay right now, so we have to be careful in that in taking the medications. Sometimes it's the side effects that may make a difference. Um, which can also add to that disproportionately being affected because we got to get to a point where we're conversational with our providers and our healthcare professional. And I like for people to have a healthcare team, if at all possible. So you can really.
When you say a healthcare team, are you talking about a healthcare team at your primary care office or a healthcare team across town? Or how do I
I'm
maybe?
talking about from a personal standpoint, a healthcare team. You talk to your provider, you talk to your pharmacist. If there's anybody else, you can talk to the nurse. I mean, but you have people that you can talk to about your health. Because, like I
Mhm.
said, a lot of information we get sometimes comes from our parents or our peer groups, and sometimes the information is not accurate. So, have a healthcare team that you can discuss these things with, and they can give you, resources that you might can go to give you better information about
So my friend, and so I told you I was going to throw some of this information
them.
as it relates. And so I did ask him, when was the last time you've been to the doctor to just have a checkup? Not that anything is wrong, not for STD screenings, but just get a lipid profile and get a checkup and see what's going on.
Hmm.
And he said 3 years. And I asked him why. And one of the things that he did say was that he hasn't found a primary care doctor that he feels he could talk to. That was one
Okay.
thing. And I do think that that is very important because once I choose you, and I'm very particular about my primary care doctor when I move to different locations. I've been
Hmm.
to quite a few different places. And so my thing is I need to feel something with my primary care. I need to feel that level of comfort because I got to tell you everything. If I
Right.
don't, I tell my doctor things that only me, him, and God knows.
Yeah. That's
I'm
right.
like,
That's
I
right.
might tell my mama or daddy, but the doctor is going to know. And I go in with, hey man, listen, this is what I did, this is what I do.
Hmm.
Do you think that has anything to do with anything? Or make
Right.
sure nothing related to that is happening, or you don't see any signs and symptoms of those negative lifestyle habits.
Right, right.
Yeah.
I'm glad you say that because when you look at it statistically, I have trouble with that word, but statistically, people spend more time with their pharmacist than they do with their provider.
Really?
Uh, for what reasons? I don't know if it's that the doctor doesn't have a lot of time because he's got so many patients to see. But a lot of times when you walk into that community pharmacy or whatever, then you have conversations with your pharmacist, and they can see a lot of things sometimes that they can relate back to the provider to again help with your health care. But you mentioned trust is very important. You got to have somebody that you can, um, as you say, dialogue with, somebody you feel comfortable with. Because at the end of the day, it's just like a friend almost. If you don't feel comfortable with somebody, you're not going to tell them anything. I
Right.
had a patient one time because I do smoking cessation too, and I told him, I said, well, if you can't tell me the truth, I can't help you. You know,
Hmm.
so he would just tell me every time, I done stopped. I came down to 2 cigarettes. I'm down to 1 cigarette. But I saw his mother one day, and I asked
One.
her, well, how's he doing? He said, he's smoking like a train. But I can't help. Nobody can help anybody if you
Right.
can't tell the truth. So you got to have somebody you feel comfortable with enough, as you say, to talk about those things in your life that really are close to your heart. That
So do
you don't
you
really want
think
everybody to
that
know.
So how can an African American male, so you're saying, so men out there, if you're not going to the doctor or you don't go to the doctor as much as you should,
Hmm.
you're saying that a pharmacist can be the next best thing just to be able
Yes.
to ask questions. Let me ask you this. What if I'm not even getting any medication, can I go to the pharmacist and say, hey, can I have a consultation with the pharmacist?
Yes, you can. Yes, you
Really?
can. Yes.
Oh,
Yes.
so wait a minute. So did you tell me I just found the self checkout line for for the doctor? So I can go up to a pharmacist and say, hey, I just need a consultation with the pharmacist and say, hey, I got a couple of things going on. And then he can maybe give me some, maybe some preliminary advice, or let me know if those reasons are reasons to go to the doctor. Like you need to go
Yes.
to the doctor for that, or you don't need
Yeah.
to go to the doctor for that. What you need to do is XYZ.
Right. I do it all the time.
All right,
Yeah.
man. I
Do it all
think I
the time.
just found a little bit of a way now. That's one thing out there. So if you're not going to the doctor, next time you go to Walmart and Walgreens, just stop by the pharmacist and tell them, say, hey, and you can even get your blood pressure checked.
Right.
At,
Yes.
right?
You can get your blood pressure checked, and it simply could start from that conversation. Checking my blood pressure and I noticed this. What do you think? You
And
know,
the pharmacist might have some suggestions on what doctor might be good for you, or
right. They would pretty much tell you, you need to go see a provider,
Mhm.
and get things checked out.
Can they suggest a provider? Is that ethical to say, hey, I suggest you go over here to this provider and see him or her?
You can, but basically most people want to talk what kind of a provider they need to see. They may have one personally they want to see, but if
Hmm.
not, yeah, you can suggest a provider,
Okay.
for 'em.
Okay.
Yeah.
All right. So let's see. Trust, since we're talking about trust, I'm gonna stay in line with that. Trust in the healthcare system can be a challenge for some members of the Black community due to historical and personal experiences, which we kind of touched on it very lightly. Let's see. How can a pharmacist help build trust and encourage patients to stay engaged with their medication and treatment plans?
Okay, one thing we did, one of my coworkers, we had a health fair. She wanted me
Mm-hmm.
to help participate in the health fair, which I thought was very good. We had a health fair in Hattiesburg, Mississippi, and we had a team of pharmacists. So that's like a little, I call it a healthcare coalition. And it doesn't just have to be pharmacists, of course, but I think building a coalition amongst, since we're talking about African Americans, building a coalition among African American healthcare professionals is something that we need to be, intent upon doing, because that's one way we can help our people a lot is through that coalition. Because like you said, at the end of the day, a lot of people don't trust other people to maybe tell them the truth about an issue, or they feel like they ain't got enough time to talk and they just rushing them out. So having
Mm-hmm.
that coalition like that allows that patient to just come in and have a good conversation and find out information. They get relaxed and you can find out a lot more about what's going on with their health. As a matter of fact, we had that today. We had Magnet Day. That's why we got the shirt. One of the things they asked us to do was to perform blood pressure screenings or talks after the provider got through with the patient. And I just had a patient. She was just so thrilled and excited to have talked to a pharmacist. And I made some suggestions that the provider agreed to go with, and she was just excited. It was like, well, I can't wait till the next time we talk, so we can see where I am, how much healthier I may have become. So those kind of things help.
I think I'm really excited. I think the biggest part of this interview that I'm going to take from it is the fact that I can go and speak to a pharmacist on small things if I can't get to my doctor, or if I don't quite have a doctor in that area as of now. I just thinking about it, I think I would feel more comfortable with that if I move to a new area and I can say, hey, let me go over and talk to this pharmacist real quick. Or I know more pharmacists than I do doctors, to be honest,
Hmm.
personally in my life. So I personally run across a pharmacist before I run across someone who's actually a doctor. So I think that's a really good thing. Can I ask you about relationships with pharmacists and doctors? Do you guys do you communicate back and forth with the doctor consistently, and when does that interaction happen if you do?
Well, we do here at Family Health Center. We have a very good communication between provider and pharmacist, and it's been going really well. And that's another thing that I wanted to say along with when I talked about building that coalition, is also we need to share our personal experiences as well.
When you say personal experiences,
Uh,
who are we
Healthcare,
talking
we're talking about the healthcare provider or
okay
professional to share your
with?
experiences that you have with the healthcare system. Because sometimes that helps somebody else to realize, oh, okay, well, I'm having that kind of issue. So what did you do about it? How did you handle
Yeah.
that?
Yeah.
Because when you look at providers and patients, sometimes I think, they're not afraid of medicine because they're providers, they're doctors. But sometimes I think it's still an interpersonal skill and not
Mm-hmm.
really know how to treat a person of another color, or they just don't know how to engage. So if you can get tips on how to help them engage, then you can build that relationship of trust.
Mm-hmm. I think it's always good to just be yourself. If
Yeah.
you just be yourself, the person that gravitates to who you are is going to gravitate to you no matter what color you are.
Yeah.
So I think that's always a good baseline to go with. But you're right. I can see it being a challenge, a little standoffish, or maybe just a little more comfortable when you do talk to someone who is a part of your ethnicity and community. Okay. So you're saying that doctors and pharmacists naturally, or if they're in the same clinic, or
But let me tell you this,
like a
Astrid,
Walmart. Let me ask you, this may be a little clear. Would a
okay.
Walmart pharmacist be able to talk to my doctor, even though he might not know my doctor, if I get my
We
medicine?
do Well, we do call providers. If we see there's an issue or problem, we
Mm-hmm.
do call the provider. But here's the thing about that. Like just like you talk about trust with patients and providers,
Mm-hmm.
there also has to be trust between healthcare professionals. And
Mm.
sometimes that trust can take a while to build because there's sometimes when a provider doesn't feel that a pharmacist can actually perform or do what they need them to do. And sometimes, the conversation helps to get over that. And then you start to say, well, you know what, I'm gonna call on them to do this. I'm gonna call on them to do that. So
Hmm.
trust has to be built that way too.
That's interesting. I never thought about that.
Yeah.
I never thought about providers, trusting providers I guess that would relate to sending referrals out as well. You,
Yeah, and that
if
could be with anybody. That's not a
a
issue with
pharmacist,
race. That's any it's anybody.
I
You
love
have to
it.
trust that person.
I love it. Okay. All right. So let's talk about for listeners who may have stopped taking the medication because of side effects. Let's roll into that. Cost concerns or simply just forgetting. What's the first step they should take to get back on track safely? I know we talked about people to stop taking medications, and there's a few reasons why. What steps can they take to remedy that?
For one thing, I think by all means, talk with your physician or your pharmacist about the side effects, because there's some medicines that do carry some side effects that just don't seem to be that good. You really they may be temporary, but also they may be debilitating. So you have to be careful. So that's why you talk to your provider or pharmacist. Your pharmacist is actually going to refer you to your provider, but at least you can kind of find out where you need to go.
But what do you do when someone says that you need a medication and you say, what are the side effects? And they say some crazy stuff and you don't want to take that medication. What do you say at that point? Because honestly, when a doctor says that, hey, I'm going to prescribe you this medication, because I've built that trust with that doctor, a lot of people don't even ask what the side effects are, or I don't feel that if they tell me what the side effects are and I don't like it, I feel like it's either take the medication and get better, or I have no alternative, so I just do it anyway. So what do you do when you don't feel that you want to take that particular medication because of the side effects?
Well, most providers will tell you what the side effects are. And
Mm-hmm.
if they don't, then that's why you have consultation with your pharmacist, but they can go over the side effects with you. A lot of times they may tell you that these side effects are temporary,
Mm-hmm.
but if they get worrisome or bothersome, then come back and we'll change you to something else. Yeah, because what they're
So do you
looking
just
at,
go back to your doctor to get it changed
right?
something? I go to the pharmacist and say,
You
hey,
go to the
this,
doctor.
okay.
Yeah, sometimes he'll call the pharmacist and say, "What do you have in this class or whatever that might be just as good, that might not have as many side effects." Like I said, doctors know a lot of stuff, so sometimes they already know that information. But in
Mm-hmm.
case they may need to get some assistance, they'll ask the pharmacist if he can look it up for them if they ain't got time to do it. Uh, but that's what you do because all medicines have side effects.
All
That's
medicines
just
have side
that's
effects.
just the bottom line. Yeah, most of you may not experience those side effects because they're going to list them in groups like, let's say you have a 10% chance of having this,
Oh,
20% chance of having this. 5% chance of having this, less than 2% of having this. So you have those things. So sometimes if it's so low, it's like,
Mm-hmm.
yeah, you may have some stomach upset, but just take it with some food and you'll probably be okay. That may be something they'll say to you. Um, but if it's something that's got what they call a black box warning, these are things that you really have
Black
to pay
box
attention to.
warning. I gotta write that down. I've never even heard
Yeah.
of that. A black box warning. What is that?
Some medications have what they call a black box warning, like I'm gonna give you an old drug, Timopic or Timolol eye drops. They were what they
That
call.
is one.
I know. I'm just telling you now. So not that you'll know what it is. I'm just telling you so I can
Don't
explain what
know.
black box is. So
Okay.
it says that it's a beta. I think it was a beta agonist. So if you have asthma, don't take it because it can precipitate an asthma attack.
Okay.
So you have to be careful that it'll have a black box warning of that. So if you know you got asthma, then don't give me the eye drop. The doctor know not to give it to you because it can precipitate an asthma attack. So that's what you call a black box. Some black box want to deal with your heart, to say this medication may have some effects on your heart. So the doctor has to be careful if they give it to you, what to watch for in that case. But yeah, those are things that'll pop up. And people are going on the internet a lot and they see a lot of things too. So
All right. So you got to work with me here. I got a question or two. So
okay.
if it has a black box warning, are we talking about those medications or even supplements that say, don't take if you're pregnant or trying to get pregnant? And I'm
Yeah, that would
speaking
be that's like a black box warning.
it's like a black box warning.
It's something
Okay.
you really need to really be cautious about.
So then that's one of the reasons why. So that's why they always ask me, they always ask for my health history everywhere I
Hmm.
go.
Right.
Because okay, because of those black box warnings for just about anything, honestly. Um, okay. I have a question to ask, and this question might be against your pharmacy religion.
Uh-oh.
Yeah. Because I am on a journey. I'm on a natural journey, Mr. Ron. And I know that you as a pharmacist, you recommend medications. I'm just gonna ask something simple right now, and maybe we'll get into it a little deeper, or maybe I'll just leave it alone. I'm not sure yet. But what are some suggestions for people who are interested in not taking medications but want to go more of the herbal route, especially men, since it is men's health? I mean, I have a cold or I'm not feeling well, I have a fever or something like that, and I just don't want to take medication because it is scary, to be honest with you, these days, because it's
Yes.
always something crazy. You see all these shows, if you stay up to 12 o'clock, you're going to see a commercial that say, if you have
Yes, you
taken,
will.
you are entitled to
Yes,
$1
you will.
billion. I'm like, did I
Yes,
take
you
that
will.
medication back when I was in college? I'm not sure. So what are some suggestions for those who are trying to get more on the using food as medicine versus taking actual medication?
Okay. I'm glad you said it, Astrid. And it's not against my pharmacy religion. It may
Okay.
be against some others' pharmacy religion because again, that's how you receive your income. But with my conversations on health, one of the things that we do is we talk about plant-based diets.
Mm-hmm.
Because there's a lot to be said about plant-based diets and how it can help alleviate certain conditions in your health. It's not that you can eat it one time. You have to make this a lifestyle. But there's some information out from Harvard Health, Cleveland, I
Mm-hmm.
think it's Cleveland Institute, and they talk about it a lot about it. Back in the day, used to, they didn't talk about that. But now they found a lot of research, a lot of data on how it improves your blood pressure, how it can improve men's prostate health, how can it improve your diabetes? And as a matter of fact, we had some people come down who showed how you can reverse diabetes through eating the
Mm-hmm.
plant-based diet.
Yes.
They wanted to put it on the radio, but the radio show was so skeptical that they wouldn't announce that you could cure diabetes because they just didn't see it. But after looking at more literature, even though they had already brought it up, the literature states that you can reverse diabetes with a
Well, I've
plant-based
seen
diet.
it as a trainer. I have
Yeah,
had clients that have gotten off of diabetes medication, and blood pressure medication.
yeah,
So, I mean, I'm a big believer to say yes, it can be reversed, or it can, diet and exercise is the cure for
that's the
most,
cure.
if it's not genetic specifically.
But just think,
But what would you say about, what would you say, is there any advice you would give to those who a doctor says, you're pre-hypertensive, or you've gone into phase 1 hypertension, which is high blood pressure, and I recommend that I want to put you on this medication, and you say, well, hold on, since this is the first time I've heard this, I want to try the natural route. What is there a process? Is there some sort of, you need to test some foods? Is there some research you need to do? What would you suggest for that
I would
person?
suggest doing some research,
Mm-hmm.
talking to some individuals who are already trained in plant-based diets. That would be very key. Uh, and if you think about it, and you look at when you get on, like, you diabetic, and they give you a diabetic diet, it consists of a lot of plant-based stuff. And then even when you look at the plate method, they tell you how much stuff going to go on your plate. They say you need to make at least three-fourths of your plate
Three,
plant-based foods.
three, four,
Three-fourths.
so guys, if your plate's like this, I mean, I need this much of that plate to have
Yes,
plants on it.
that's fine.
Like,
And they
period.
did studies. When I had an environmental health class, and they did studies, and we found out that in some countries, meat is a delicacy. It's not something they even eat every day. It's maybe once a month or whatever. They do a lot of plant-based stuff, and they show how the cancer rates are so low in those countries. So there's a lot to be said about plant-based diets. I don't know why more Americans are not into that. And I can probably speak for myself, saying
Well,
I'm not all the way into it, but I'm trying to get there.
working on, we're all a work in
We
progress.
work in progress.
We're all a work in progress. I am going to say that I think, in America, we are hyper focused on muscle growth. We're
Yeah.
hyper focused on how we look. And I think meat-based protein does contribute a large contributor to your protein intake, muscle growth, and all those things.
Mhm.
And I think that because every time I talk about, being around people who are in the gym a lot, and I talk about going on a plant-based diet, 9 times out of 10, I'm going to get a funny look, and they're wondering, what am I going to do about protein? So, I said this, people really don't understand how you can get a healthy protein in without eating meat. So one, a lack of education is
Right.
what I'm going
Exactly.
a lack of education.
Exactly.
But yes,
Yeah.
Americans, I think about that. All these other countries that eat so well. I mean, they have very good health conditions, very positive
Mhm.
health outcomes. And in America, we eat a lot of meat.
Yeah.
I mean, a lifestyle thing, and I think that it not so much as a delicacy, but a privilege almost to eat.
Mhm.
And so, as you're able to eat meat and you're able to afford things, meat becomes, because think about it, when someone wants to eat a fancy meal, they're going to go get a steak.
Yeah.
They're
That's
not
right.
going to go and start trying truffles.
Right.
They're not going to try
They're
these
not gonna do it.
exotic plants and things that, I wonder how many people even know what a shallot is, different
Right.
types of onions and stuff. Seriously,
Yeah.
but they, when you think of rewarding yourself, when people think of, I'm fancy, I'll put it that way, they
Mhm.
think of meat when it
They think
comes
of
to eating.
me.
They think
But
of meat.
uh, plus I think to tell you something else about me. Oh, some industrialized countries. That's what I was going to say.
Hmm.
Those are countries that sort of like us. We got it together. We got in factory, we got industrialization, we got all this stuff. But that thing that's like 27, maybe. And you can look it up too. If you need me to come back and tell you, I can tell you. But there's things like 27 countries on that list. But the United States spends the most on healthcare, but we're not the healthiest country. That's something. I mean, that's something to stop
We
and
don't
take.
talk politics here. We don't talk politics here.
Okay, all right.
Don't tread over that. That's a fact. That is
Yeah.
a fact. That's
Okay.
that.
We, we,
That's
we,
not,
we'll leave it right there. Then we'll leave it right there. But that's a fact.
yeah.
Okay. Oh,
So
but you were
go ahead.
saying too about we're talking about uh people who stopped taking the medication. That's where we were. Were we
Yes.
there?
Hmm.
Okay. And some other things. If cost is a concern,
Yes.
Then talk to your pharmacist about possible alternatives, or the doctor about all low cost alternatives to what you got. So that can
Is
be a
that something that, let me ask you this. Why is it that some pharmacists or doctors, they go ahead and prescribe you the generic medication? I get a little offended by it. I'm gonna be honest. Can I be real with you, Ron? I get a
yeah,
little
be
offended.
real.
If I come in and you just prescribe me the generic medication, I'm wondering why didn't you give me the brand medication? I just have a real challenge with automatically giving the generic medication or vaccines or whatever it is to people. Because I
Okay.
don't know if you're targeting me. I'm not sure. You didn't ask me questions. I'm trying to figure out what did I say to you to make you think that that medication is better for me.
Okay, so now you're going back to talk about those things about trust and about about bias and those kind of things.
Yeah.
But a lot of times, sometimes medication does not come in a generic. Number one. Number
Okay.
two, when you do get a generic, they got what they call an AB rating.
Okay. I'm
And what
listening.
that means is if it's AB rated, then that means it should be the same as the brand.
Hmm.
But if it's
Trust.
not,
Back to
then it's
trust.
not the same. There are lists out there that you can get to tell you whether something is AB rated and whether
But
it's
why?
just
But why prescribe me the generic?
because they're thinking about cost a lot of times. And
So
most
I
people
look
don't
like
want
I
to go
can't
ahead and
afford the brand name. I'm just asking questions, Ron. Do I need to wear Gucci to the doctor so I
hey,
can
and
say that I want the
that may
generic?
that may very well be the case. We talked about implicit bias before. That may very
Yeah.
well be the case. Because
Mm.
I've had patients, the doctor write it in, but they always say you can substitute if you want to.
Yeah.
If the patient allows it. And I have patients tell me that no, I don't want the generic. Then you tell them the cost of the brand. It's like I don't care. I'll still pay for it.
Yeah,
So
because it's not really with you just giving me generic brand. I feel like sums up with that. It's a trust thing, and it's not about me not trusting my doctor.
yeah,
It's the medication that I'm not trusting. You
yeah.
know.
But a lot. Let me tell you this now, and you got a point. And I'm not telling you that every generic is bad. So don't get me wrong, because
Hmm.
a lot of people take generics, and a lot of generics are really good. But
Hmm.
if you don't check the AB rating, then you don't know if somebody's ordered something, not intentionally maybe, but ordered something that's not AB rated and it's not as good as the brand name was. There's certain medications that they would tell you don't want to swap between brand and generic. If you start taking it, you need to continue taking it
Well,
because
when
it
do
will.
I check the AB rating? Because the doctor told me he's about to write me this prescription when I'm sitting in the doctor's office. Do I pull my phone out and start Googling and saying, is this AB rated or what is
The
the AB?
first thing you do is you talk to the pharmacist and you say, I don't know about taking this generic. What do you think? Is it going to be the same as the brand, or maybe that may be because most pharmacists are going to tell you that if they're not sure, well, they may say it may not quite act quite exactly like the brand, and then that's when you say, "But give me the brand," you know.
Mm.
But
Well, how
again,
much
like
is
you
the
say,
brand?
there
That's
you
the
go.
first
And say
question.
sometimes affordability,
How
it
much
gets
is the
really high.
brand?
It's like,
Well, how
okay,
much is the brand?
I can do it 80, I can do it
Oh,
95% versus 100% if it's going
this
to save me $200, something
right.
like
I
that.
walk around with some itchy eyes for a little while if it
Yeah,
costs
for
too
a little
much.
while. But like I say, it's a thing to look at when you talk about generics. But and all no, like I'm not saying all of them are bad. There are a lot of them that are really good, and you just have to talk to your pharmacist about those things, and they can tell you a lot more because they have all the material there. They can check things out, and when they order, they can order things that they know is going to be equivalent.
Well, and that you've given me a new outlook on how I pick up my medication because I used to if the doctor sends in a medication, I just go through the drive-through and just pick up whatever the doctor has or prescribed. But now
Hmm.
I feel after talking to you, I feel that I should the first time I take if it's the first time I've ever taken this medication, I need to go inside and
Yes, you
have
do.
a consultation with the doctor about that medication.
Yes, you do. Yes,
Yeah,
you do.
yeah,
Yep,
yeah.
that's always a good thing because again, you'll find out a lot more. And like I said, a lot of people on the internet now anyway too, and they gonna look up stuff and it's gonna say, "Well, I took this," because you read all the comments that people have. I took this and this happened. Well, I took this and this happened. So you get a lot of confusing information. So yeah, if you're taking it for the first time, by all means, have a consultation.
I love it. So I want to talk about mindset, and I'm still on African American men. And the reason why I'm on African American men is because African American men have statistically been shown that they go to the doctor and get wellness checks and visits, or go to the doctor less often than any other
Hmm.
ethnicity. And we, our men usually wait until something is actually physically wrong before they go
Exactly.
to the doctor.
Yes, they will.
I did ask my friend about that as well, and he did admit to that. He was like, nothing's wrong. And then one was that he was so busy. His thing was
Hmm.
he's busy. He's busy. He goes from state to state with business, and he just don't have time, and he forgets. So I do want to, ask this question. There's often a strong emphasis on being tough and pushing through health issues, right?
Hmm. Right.
Men, they have, they don't feel well today, they're going to push through and see, how do I feel tomorrow? Maybe the day after, by the third or fourth day, if it's any worse, then I'll go to the doctor.
Yeah, exactly.
Well, how can African American men shift that mindset and view medication adherence, and we're talking about medication, so of course this is after they've gone to the doctor, as a form of strength and self-care rather than a weakness?
Okay. What I have to, I go back to on that is what I talked about earlier about how our parents were or our
Mhm.
grandparents. Because I can remember the days, again, I don't want to tell you how old I am, but I can remember the time when,
Either one of
and
us will.
I was in the North, but I can
Uh-huh.
remember going to my dad taking me to the doctor's office and there being a separate side for African Americans. There was a side for whites and a side for African Americans.
I
Now,
almost said,
I,
almost, almost related to a Martin Lawrence line,
uh-oh.
but carry on.
Well, I say that to say this because when we talk about being tough and pushing through, we don't know why our parents pushed us like that. And see, some of that come from that reasoning that they could not get the access to the health care that they needed when they
Mm,
needed it. So they had to try to make you be strong.
mm,
But see, now we put that same thing on our kids when it's not necessary. I'm not
mm.
saying run to the doctor every time you have a cough or whatever, but you got to get that mindset out that you got to be. That's not being tough. Sometimes you're missing out on something that's going on in your body that you don't know going on because you won't go to the doctor.
Do you think that that plays a part into as to why some non-African American doctors feel that African American people can tolerate more pain?
Yes, I believe that's part of where the implicit bias comes from.
Mm,
You know, and you've seen parents tell their kid that suck it up, you ain't
mm-hmm.
hurt. You know, you got a bone sticking out your arm. You okay? Just suck
Put a
it up.
Band-Aid on. Be fine.
Yeah,
Put
put a band-aid
some
on it.
alcohol on it. A little witch hazel.
That's right. And
Okay.
and with that mindset, again, I probably would not be here today if I
Mm-hmm.
had followed that mindset. My
Really?
brother would probably not be here today if he didn't follow that mindset. And I know you talk about men's health, and one of the big things in men's health is prostate. And I wound up being diagnosed with prostate cancer back in 2019.
Mm-hmm.
It's only because I kept checking on my prostate as I should have, and
Is
the
it,
numbers
is
went
it
up.
scary? Because, now I'm getting to the era of mammograms.
Hmm.
And there is some little anxiety to go to the doctor and say, hey, I want a mammogram. So I can imagine men going to the doctor and getting a prostate checkup, because I want to help our men,
Hmm.
no
Right.
matter what ethnicity or race that they are. I want to help them to go to the doctor, be the healthiest that they can be, live the best quality of life as far as health. But I feel that I do understand, or I do empathize with them, because it is a little scary when you get
It's
older.
scary.
Yeah, because
It's,
what happens
it's
in time and there's something wrong.
right, and that's a lot of times why men don't go to the doctor or go get their checkups because that very thing it's anxiety. A lot of times you don't want nothing to be wrong, but we
Mm,
got to get out of that mindset. Just because I don't think nothing's wrong, that means nothing's wrong. Because you could be a ticking time bomb and not know it, and then
yeah,
when you find out, it's too late.
yeah.
So that's why I would encourage them to think about where you want to be in 5 years. And what I mean by that too is that, do I want to be healthy? Do I want to
Mm,
be around for my children? Do I want to be around for my wife? Do I want to continue to be that provider that I am now? Those things you think about. And if you think about them that way, then you say to yourself, possibly, I need to get checked up. I need to find out what's wrong with me. But I think what makes it hard also is, you have people in blue collar jobs, factory workers, or you're expected to be there during your shift, whether it's 8 hour shift, 12-hour shift. And they're very hard on you sometimes if you're not on that shift because they have
Yeah.
production they got to meet.
Yeah.
So then it gets hard for that person to say, I need to take off and go to the doctor. Then you get that same emotional thing going where, oh, you should be tough. You shouldn't have, So there are things that lead to that. Us not going to the doctor a lot, but we got to make sure we become a community of one. And again, talking about a team where you can just encourage each other. We got to get checked out, man. We don't have a strong community. We don't have a strong community. We can't be there for our children. We can't be there for our spouses. We can't take care of the household. So we got to take care of ourselves. It's like the old adage with the plane, when you're on the plane, what they tell you to do with the mask first if oxygen falls. If the oxygen gets
Put it
low,
on me first.
they tell you put it on first because you can't help nobody else if you can't help yourself.
You can't help yourself. I think, I think it would be a good idea. Just like, I remember when I first started in the fitness world, in the fitness realm, in the industry, there were no gyms at work sites. There was no work
Right.
site when I first got started. That was something that was just getting kicked off when, and being discussed, and they were doing, speaking and getting people's information and input about it. I think it would be great to have even a pharmacist on some of these work sites, and also
Yeah.
a doctor's office,
Yeah.
a team there on the site, and hire, providers to be there, so that people can go to the doctor and get a regular checkup. I think that would help.
I think
That
that would.
for yeah. So
We
those of
talk
you who are
about wellness.
decisions, guys, that's something that you can put down on paper. I think that
That's
would
right.
really be a good idea.
I think a good selling point for that would be, if you look at the statistics, I can't say the word, Astrid. When you look at statistics, it
Smile when
shows
you
how much money we spend on healthcare and how much we spend on different disease states.
say,
We can do preventative medicine, like you said. You have your doctor's office, you have your pharmacy, you got your gym and stuff. Then you could save a lot of that money that could bring your costs down to the government, which you can use for other things. I mean, there's a way to sell it if people just buy into it.
I like that idea. I'm gonna see. Let me see. I'm gonna have to go and talk to the Walton Foundation and see what we can get
Okay.
Walmarts. I think that'll be the best first place to get that, to pilot that idea.
Yeah.
Is to put a pharmacist in the doctor's office for employees actually on the work site. That in some factories, different places like that, blue collar workers, to where if you want the production to stay up, then give people what they need so they can live a healthier lifestyle. Well, Ron, I do want to. I thank you so much for joining me today. I thank you so much for your valuable input. I thank you so much for doing what you do for the community.
Well, you're welcome, Astrid. I enjoy it.
Thank you. So guys, remember, talk to your pharmacist. If you don't want to go to the doctor, you go to a different location. You've moved, you've relocated. You can always go and speak with your pharmacist about things that ail you. And you don't have to have a prescription in order to talk to a pharmacist. I think that was a very important thing to get out of this interview. Black box warnings, pay attention to those. Food is medicine, so let's make sure that we are paying attention to what we eat, and it's okay for us to try to eat to prevent disease versus, just looking to go to medicine as well. I think those were some really good points right there, to take away from this interview.
Okay. All right.
All right, Ron, thank you again. I really do appreciate it. And guys, thank you guys for joining me. Ask Astria on 90.1 WMPR. I'll see you next Monday, and have a wonderful night. Let's get into it.
All right.
Now I charge per breath. I was overlooked. Now I'm booked past death.
I love this
Had
song.
tables turned.
Oh, yeah.
I flipped the room. Now they whisper my name like I'm bad juju. I birthed trends they try to mimic. Did it solo, ain't no gimmick. They took notes while throwing shade. Now they pressed and I got paid. I'm not one of them. I'm one of one. Trying to match my glow. talk about me in rooms I don't enter. I haunt them like regret, make them bitter in the center. I'm that girl, the headline in the smoke. They playing in mirrors, I'm shattering your